Okay, so we will continue then.
One second. Okay, sir. Start.
Sir, live starting, sir.
Let's. Okay, so we have completed a surgery. Now, during the surgery, you are all asking, can we just do a DISE? Can we not do a? Do we have to do a pulse somnogram? These are two different investigations. Pulse somnogram, or otherwise called a sleep study, is only going to diagnose having sleep apnea or not. You definitely need a sleep study. That is number one. But a sleep study does not give you the type of collapse or the level of how severe the collapse is. So for that we need a drug-induced sleep endoscopy or a dynamic MR. So both are needed. Both are complementary. Okay. So you cannot just bypass one. Now, you also asked me what is sleep study. The sleep study, I have in brief told you what are the lessons of sleep study. If you take into the level 1, that is the gold standard sleep study, we will be connecting the patient to multiple electrodes like this. Patient will have EEG and then we will have an EOG program and we will be doing a EMG of chin, EMG of anti-realism or restless leg syndrome. We also have respiratory channels like nasal airflow, oral airflow, and belt and an abnormal belt. Then we will have optional of using tidal. Then we will have a pulse. We will have a diagram and a electromyogram. Have the option of getting this your recording, provided you take a consent telling them that you are recording the sleep, and you can record it. This is how they are going to monitor these, and they are also coming as a strain or something. Based on stage 2 or REM sleep. This is the sleep spindle and K complex. This is the classical K complex, and this is the will tell us that stage like a slow. If there is a rapid roll, the electrode will be like a thin line because of hypotonia. And this is the EKG channel. This shows the scoring that is happening here. And these are all the respiratory channels. Saturation. So, patient has gone for the eyeball for apneic nasal airflow or oral airflow. There is okay. So, which is more than 30 seconds and more than 10 seconds. Okay, because it drops from sleep time. What is the total sleep time? Your sleep time tells you whether the patient's sleep efficiency sleep study has been good or not. Let's say if the sleep time is 1 hour and the total recording time is 8 hours, the sleep efficiency is so poor. So you cannot take that report for that particular night. So you cannot base any treatment based on that, diagnosis based on that. So your sleep efficiency should be 80 to 90%. Only then you can have a good sleep report. Now, after the total sleep time, you also look for whether the stages of sleeps are recorded. Whether stage 1 sleep, stage 2 sleep, stage 3 sleep, and there or not.
Is there any
number of hypopneic episodes per hour gives hypopneic index, and apneic index plus hypopneic index together we call it as hypopnea index. And if this apnea hypopnea index is more than this, more obstructive episodes. So, I'll just decipher. We have talked about the hypopnea index. We have talked about the saturation, desaturation index. We also have to see about the lowest level of desaturation was maintaining average lowest desaturation. We call it as LSAT, and we also have to see in what various types of body position, whether it is happening in the supine or whether it is to reduce the amount of lot of snoring and there is no apneic episodes. All these things we have already. So from this we will this what is apnea? Cessation of breathing more than 10 seconds. Hypopnea 50% reduction in effort, and this is apnea index, hypopnea index, and these two together. What is respiratory disturbance index? Is apnea hypopnea index plus respiratory event related arousals. If there is also arousals due to the respiratory effort being there, that we consider as RAJU, and this together we call it as RDI. Okay, so based on the RDI we classify into mild, moderate, severe. Of note, you have to note that in pediatric age group, even more than one episode of AHI or RDI, more than one, is considered abnormal, and if more than 10 it is considered severe sleep apnea.
Only that.
In
But
pediatric.
that is not for
That is for adult. This is a level 3 sleep study. This is a level 3 sleep study which we ENT surgeons can use it because the patient. Also this one that is going to record the body posture will record the saturation. So now this is the report of this particular device, level 3 device, wherein this will tell you whether the patient has slept well or not. Example here, see the recording time is 7 hours 41 minutes. Whether the sleep time or evaluation time is only 5 hours. The importance of this is this patient having desaturation, and this definitely the patients are going in, and then you worry that yes, except for that reasons you don't have to worry much. That is not going to lead into much of a complications, provided they don't convert them. By 15 to 20 patient can have ischemic heart disease or even and have urinary impairment, sexual dysfunctions. These are all the complications.